If you're 70 or older, stop scrolling right now. Your medication might be failing you as we speak. After age 70, your body handles drugs completely differently. Your kidneys slow down, your liver changes, your metabolism shifts. That means pills that worked perfectly at 60 may stop working now. Or worse, they could become dangerous without any warning signs. Studies show that 1 in 3 seniors over 70 takes at least one medication that's no longer effective. Today, I'm revealing all 6 medications that commonly fail after 70. Stay with me until the end. Point number 5 will shock most people watching. Millions of Americans take it every single morning without knowing the risk. If your pills have ever stopped working on you, comment yes below. Let me share something that happened in my practice recently. Last month, James, age 74, came to me frustrated and worried. He said, "Doctor, my blood pressure pills just aren't doing anything anymore." His blood work told the real story. The medication wasn't reaching proper levels in his system. His kidneys were filtering too slowly for that particular dose. We made one simple adjustment. Within 1 week, his numbers improved significantly. This happens far more often than you'd think after age 70. Stick with me until the very end. Point number 6 will surprise most people watching. It's not even classified as a medication in the traditional sense. But after 70, it behaves exactly like one, and it's sitting in most medicine cabinets right now. Number 1, blood pressure pulls, like hydrochlorothiazide and lurthalidone. These are commonly called water pills for blood pressure control. After 70, your kidneys filter much slower than before. Slower kidneys mean the drug builds up in your system. This buildup makes it less effective and potentially more dangerous. Let me introduce you to Linda, age 72. She took her water pill faithfully for over 10 years. Suddenly, her blood pressure stayed high every single morning. Testing showed her kidney function had dropped by 30% recently. The solution? Ask your doctor to check kidney function yearly. Kidney function is measured by eGFR on routine blood work. If eGFR drops below 30, water pills often stop working properly. Your doctor may switch you to a different drug class. Never stop blood pressure medication without supervision. Stopping suddenly can trigger a stroke or heart attack. Also, ask your pharmacist about timing and food interactions. This is general information, not personal medical advice. Number 2, sleeping pills like zolpidem, brand name Ambien. Sleeping pills help you fall asleep faster at night. After 70, your brain becomes more sensitive to sedatives. These sedatives stay in your system much longer now. Longer duration causes morning grogginess and increases fall risk. Even worse, the sleep effect often wears off after several months. Consider George, age 76. He started Ambien at age 68. By 75, it had stopped helping him sleep, but he still felt dizzy every single morning while walking. The solution? Talk to your doctor about tapering slowly. Tapering means reducing your dose gradually over weeks. Your doctor may suggest cognitive behavioral therapy for insomnia instead. CBTI is a talk therapy specifically designed for sleep problems. It works better long-term than pills for most seniors. Avoid alcohol with sleeping pills completely after 70. Alcohol plus sedatives dramatically increases fall and memory risk. Every 60 seconds, ask yourself, do I feel groggy this morning? Number 3, pain relievers like ibuprofen and naproxen. Ibuprofen belongs to a class called NSAIDs. NSAID stands for non-steroidal anti-inflammatory drug. After 70, your stomach lining becomes thinner and more fragile. Your kidneys also filter NSAIDs much slower than at age 50. Slower filtering increases your risk of kidney damage and bleeding. Worse, the pain relief effect often weakens over many years. Meet Barbara, age 73. She took Advil daily for years to manage knee pain. At 71, it stopped controlling her pain effectively, but her kidney numbers started getting worse instead. The solution? Ask your doctor about acetaminophen as a safer option. Acetaminophen is Tylenol. It's much gentler on kidneys. Always use the lowest effective dose for the shortest time possible. Your doctor may recommend topical cream instead of pills. Topical means cream rubbed directly on painful skin. Creams bypass your stomach and kidneys completely for safety. Never mix ibuprofen and naproxen together. Mixing them doubles your bleeding and kidney risk after 70. Drop a 3 in the comments if this applies to you. Number 4. Blood sugar pills like glipizide and glyburide. These pills push your pancreas to make more insulin. After 70, your body senses low blood sugar poorly. Poor sensing means you may not feel shaky or sweaty. Low blood sugar can cause confusion, falls, or worse. These drugs also lose effectiveness as your pancreas ages naturally. Consider Richard, age 78. He took glyburide for 15 years to manage diabetes. At 77, his blood sugar stayed high despite the pills. Testing showed his pancreas was producing less insulin naturally now. The solution? Ask your doctor about newer, safer drug classes. Newer drugs like metformin or SGLT2 work differently. They don't force your pancreas and lower the risk of dangerous lows. Check your blood sugar more often after age 70. Carry glucose tablets in case your sugar drops suddenly. Low sugar is called hypoglycemia. It's especially dangerous after 70. Never adjust your diabetes medication without doctor guidance. Proper guidance prevents both dangerous highs and lows. Every 60 seconds, check if you're feeling shaky or confused. We've covered 4 medications so far: blood pressure pills, sleeping pills, pain pills, and diabetes pills. But the most important point, number 5, is coming next. Your doctor may never warn you about this one. Millions of Americans take it every single morning without question. It stops working differently after age 70 than any other drug. Stay with me. Point 5 changes everything about how you view your medicine cabinet. Number 5. Cholesterol pills called statins like simvastatin. Statins lower bad cholesterol called LDL in your blood. After 70, your muscles become more sensitive to statins. Sensitive muscles mean higher risk of pain and weakness. Pain and weakness can make you stop walking or exercising. Worse, the benefit of statins changes significantly after age 75. For primary prevention, the benefit becomes much smaller. Primary prevention means you've never had a heart attack before. Meet Helen, age 77. She took simvastatin for 20 years, just in case. At 76, she developed severe leg pain that wouldn't go away. Blood work showed drug levels were too high for her age. The solution? Ask your doctor to review if statins are still needed. Your doctor will check your heart risk score and age together. If your risk is low, your doctor may lower the dose. If you've had a heart attack before, the benefit remains higher. Never stop statins suddenly without medical advice. Sudden stopping can increase your heart risk in the short term. Ask about CoQ10 supplements if you experience muscle pain. CoQ10 is a nutrient your muscles use for energy production. Always discuss with your doctor before adding any supplement. Every 60 seconds, ask yourself, do my legs hurt or feel weak? Number 6, over-the-counter antacids and proton pump inhibitors. PPIs like omeprazole reduce stomach acid for heartburn relief. After 70, your stomach actually needs some acid for digestion. Acid helps your body absorb vitamin B12, calcium, and magnesium. Less acid means higher risk of serious deficiencies over time. Worse, PPIs lose effectiveness if used daily for years. Your stomach adapts and acid production rebounds even higher. Meet Susan, age 74. She took Prilosec daily for 12 years for acid reflux. At 73, it stopped controlling her heartburn effectively. But her B12 levels were dangerously low on routine testing. The solution? Ask your doctor about tapering your PPI slowly. Tapering means stepping down your dose over several weeks. Your doctor may suggest an H2 blocker like famotidine short-term. H2 blockers are gentler and less risky for long-term use. Add non-drug fixes. Elevate the head of your bed by 6 inches. Avoid eating 3 hours before bedtime every night. Lose 5 to 10 pounds if you're overweight. Weight loss naturally reduces pressure on your stomach valve. Never stop PPIs suddenly. Rebound acid can be severe and painful. Discuss your plan with both doctor and pharmacist together. Drop a 6 in the comments if this applies to you. Every 60 seconds, notice if your heartburn feels worse than before. Let's lock in the 3 most important takeaways right now. Takeaway 1. After 70, your kidneys and liver process drugs slower than before. Takeaway 2. Many common pills lose effectiveness and gain risk as you age. Takeaway 3. Never change or stop any medication without your doctor's guidance. You deserve medications that help you, not harm you. Age 70 is not too late to review everything you're taking. A simple medication review could add healthy years to your life. Comment below. Which medication number do you currently take? Type 1 through 6 so I can see which one resonated with you. Like this video if it opened your eyes to something new. Subscribe so you don't miss next week's warning about supplement dangers. Share this with someone over 65 who needs to hear this. One share could prevent a dangerous medication reaction in someone you love. You've worked your whole life to get to this point. Your golden years should feel strong, clear, and vibrant. Start with one simple question for your doctor this week. Ask them, is it time to review all my medications? That single question could change everything. This content is for general educational purposes only. It does not diagnose, treat, or prescribe for any individual. Medications affect people differently. Kidney, liver, and heart changes after 70 require professional supervision. Always consult your doctor, pharmacist, or qualified healthcare professional before changing, stopping, or starting any medication, supplement, or treatment plan.